Good evening, everyone. It's such a privilege to be here. I wanted to thank Bladder Cancer Canada for having me. I changed the topic a little bit. No, that's okay. No, it's all right. To nourishment and bladder cancer and the role of supportive nutrition care. Especially within a 15-minute time frame, it's really difficult to go through all of the aspects of healthy eating, and I really wanted to let you know, walking away from here, what are those supports that you can get out in the community. This one? Okay, great, thank you. So I'm here from InspireHealth, a not-for-profit charity founded in 1997. We have a table out front if you'd like some more information. We're partially funded by the Ministry of Health, and we rely on donations from the community for the other aspect of our funding, and we don't have any, there's no charge for any of our programs or services. We have a center here in Vancouver just around the corner, one in Victoria and one in Kelowna. We can also see patients via video or phone as well. We support people with cancer with a current or past cancer diagnosis and their families, or support people to play an active role in their own care. And we really support the quality of life and well-being of our patients. This is our clinical team. We have physicians, clinical counselors, and dietitians and nutritionists. I just wanted to put this up to begin with because it's just a supportive cancer care model, and our supportive cancer care model, we've heard about these beautiful treatments that are available to you tonight, like chemotherapy, radiation, and surgery, and then we look at the lifestyle factors that can affect cancer as well. So mind-body practices, stress reduction, all of our clinicians look at stress reduction, nutrition, exercise, sleep and rest, and the role that that has to play in digestion, and then emotional and spiritual support as well. So nutrition is a complex science. And I like to bring this to the forefront because there's a lot of information around cancer and nutrition. Can you raise your hand if anyone has given you a book since your diagnosis, or an article, or sent you a recipe that they thought that you should make? Yeah? Yeah. If you Google cancer and nutrition, I think there's something like over 9 billion hits that come up. If you Google exercise and nutrition, there's about half of that. So nutrition and cancer is a very, very hot topic, and there's several cookbooks and recipe books and blogs and on about nutrition. One of the roles for supportive nutrition care is that we can be your filter for that. So please feel free to bring us any information that you would like to look through for you. Part of the fact why nutrition is a complex science is because every body is different. So patients can be struggling with different comorbidities along with their diagnosis. They may be having different side effects. Some people feel dramatic side effects from their medications, and another person could be having the exact same medication and feeling none of those side effects. Someone might be preparing for surgery, or they might be post-op. They have a different health history. Perhaps there's some heart disease or some diabetes along with that can also affect their nutrition. Accessibility to food. What's in your community? Where do you live? Do you live here in Vancouver? Do you live up north? Economically, what's your accessibility to different ingredients? Digestion and bowel health is huge when we're looking at getting as much of that nutrition as we really need to have at the time. We also need to address the digestion and bowel health. Perhaps you've had a stoma, and perhaps you have different medications such as BCG or targeted therapy that can have different side effects as well, or specific diet recommendations such as maybe a low residue diet. This is why it's complicated to do a 15-minute talk on nutrition, and I wanted to just say that if you come to InspireHealth or see any other dietitian, we can do a one-on-one consultation with you to really look at, okay, what is happening for you at the moment? What are those complications that might be affecting your nutrition status? And then we also have follow-ups, which I really love about our programming. So if you are pre-op, before you have surgery, and you have some questions around nutrition or exercise or counseling, we can follow you through surgery, post-surgery, post-treatment, and then even like years later if you want to come back and see us, we'd be happy to see you. We also offer cooking classes so that we can actually put those nutrition recommendations into practice. We have a life program, which is a 2-day program with all of our practitioners, and then online we also have some resources available. So a few tips or considerations is if you're pre or post-surgery, we can help you with looking at your hydration, because you can have different hydration needs either before or after surgery, and not just water, but also making sure you're getting enough electrolytes as well. Increased protein needs. What does protein do in our body when it comes to surgery? Well, if we're getting ready so that prehab time, if we increase some of our protein, and we can help you to make sure that you're getting enough, it can really help with wound healing overall, and also boosting your immune system a little bit before going in for surgery. Bowel health, so we heard before as well, there might be a possibility of a stoma, or there might be some affected tissue in the bowel. So really making sure that your fiber or your fiber needs are either high or low, we can help you with that. Chewing slowly is a really good tip. So especially post-surgery, when our appetite might not be the best, we might be fatigued, trying to have foods that you can chew in a nice, easy way, and also a bit slower, can help us to actually digest some of that food. So doing a part of that digestion in our mouth before it reaches our stomach. Making sure we're getting enough protein and calories. As Sarah had said as well, with exercise can really build up that muscle tissue, and making sure that we're supporting our body if we're losing any weight. Small and frequent meals, your appetite has decreased for any reason post-surgery, which is quite often seen, or any nausea or vomiting, we can really help with ensuring that your system is really supported. So let's talk about hydration a little bit. Hydration is so important, especially when we're looking at bladder cancer and making sure that we're keeping the acidity of the urine. Our bowel movements can be affected by our hydration status. Caffeine and alcohol, salt and vitamin C, those can all affect our hydration status. So we kind of forget that when we're having caffeine or lots of coffee or tea during our day and maybe not having as much water, that can throw us a little bit out of balance. Trying to drink our water slowly, or our hydrating beverages slowly, just so that everything can move through the system at a good rate. If your appetite is low, another tip to do is separating your fluid from your meals, so that we're not filling up on water at the time. Of course, our hydration status is really important, but we don't want to also take place of all those nutrients and the protein and the calories that our body needs. So try not to have a huge glass of water with our meals, and eating and really getting that nutrition in first. So research. So again, nutrition research is quite complex, and when it comes to cancer, there's not a lot of strong associations with diet and nutrition. Diet is a piece of the puzzle when we're looking at nutrition care and health care within cancer, but there is some evidence that decreasing processed meat and then increasing fruit and vegetable consumption may have a protective effect on bladder cancer. I know that sounds really wishy-washy when we say may, but really we're looking at associations that we see, because it's really hard to do cause and effect when it comes to nutrition. But we've also seen that cruciferous vegetables, so those are those really lovely gas-producing ones, the Brussels sprouts and the cabbages and the broccolis and the cauliflowers, that they actually may affect the metabolism of carcinogens in our body and support our livers. And they've shown that it may also protect against bladder cancer. So again, the evidence isn't super conclusive when it comes to diet and bladder cancer, but we know that it can play a role in overall well-being. I get a lot of questions about supplements and whole foods versus supplements. And there's a lot of supplements out on the market nowadays, but supplements should never take the place of food. Whole foods have a lot of benefits to them that a supplement that has been sitting on a shelf may not have. It's not to say that there aren't moments when those supplements can be beneficial, and it depends on the kind of supplement and all those things, and that's what we're here to help guide you through. But there's so much nutrition in a whole food. So when I'm talking about a whole food, we're looking at a fruit or a vegetable, like a tomato as an example. So we all know that tomato is kind of the poster child for lycopene. But did you know that there's also other micronutrients within a tomato that actually help you to absorb the lycopene? So it isn't just the lycopene on its own within the tomato that's great for you. Then if you cook the tomato, and we say if we cook it in some olive oil and some onions and some garlic, actually there's micronutrients within the oil and the garlic and the onions that also help you to absorb that lycopene. So we can actually get more nutrition from tomatoes usually if we cook them. So again, supplements can have a place at times, especially if our intake isn't that great, but really there's a really great case for whole foods versus supplements. I always like to bring up mental health, and Sarah did as well, which is really lovely to see. And I want to acknowledge the fact that when there's a cancer diagnosis, there's also a lot of vulnerability that comes along with that. And what I've seen in my practice is that that vulnerability a lot of times can translate to something that we have control of. Which one of those things is food, right? So, and there's so much information out there around nutrition and cancer that I feel like a big part of my role is to decrease that fear and anxiety around nutrition. Again, it's a part of the puzzle, it's not the whole picture, and there's a lot that we can do in terms of nutrition and mental health. By eating whole foods, especially those anti-inflammatory foods, those omega-3s, balancing our blood sugars. So what does that mean? In a nutshell, balancing our blood sugars is basically when we eat, trying to eat pretty regularly during the day, every 3 to 5 hours, and then also within that time having a nice combination of carbs and proteins and fats, so that we're not just having carbohydrates on its own and that we're balancing that out with different nutrients. Green leafy vegetables, and our microbiome, that's a hot topic these days. So the microbiome is all that bacteria that lives in our intestines, and they've actually shown quite a distinct link between our brain and our microbiome that we have. So how can we feed that microbiome? We don't have to go out and buy a lot of expensive supplements. Actually, just those whole foods that we eat, especially fruits and vegetables, can really contribute beneficial bacteria to that microbiome and actually help our mental health in the long run. Sleep and stress are also a big piece of that. And like I mentioned before, stress can also affect the digestion of our nutrition. So sleep, as an example, if we're losing a lot of sleep, we can actually increase our leptin hormone, which is our hunger hormone. So sometimes if we've been like really restless, we haven't been getting a lot of sleep, but we have this voracious appetite. It's kind of our body's mechanism of ensuring that we're getting enough calories because they think that something's happening in the fact that we're not getting enough sleep. So of course, this is all in addition to medications, other lifestyle factors, counseling, GP consultations in terms of mental health. But I do think that nutrition can play a huge role, especially long-term role within our mental health, and especially with that vulnerability of a cancer diagnosis. So some quick overall nutrition tips is trying to get nutrition from whole foods. Avoiding color is a really easy way to think about it. So each color of a fruit actually indicates usually a different kind of nutrient that's found within it. Phytonutrient, which means plant nutrient. So just try to have a lot of different color. Try to have about half your plate as vegetables when you're having lunch and dinner, and then try to sneak in a few veggies at breakfast when you can too. So how can you do that? If you're having some eggs, toss in some tomatoes and some spinach. Maybe some olive oil to help with that lycopene when you're having the tomatoes. Including protein, carbohydrate, and those healthy fats at each meal, which we can help you through if you need help with that. Hydration, and then really reaching out for support through one-on-one consultations that are out there, whether it's through HealthLink BC or whether it's through us, whether it's through the dietitian that you're seeing at BC Cancer. We're really here to really help you have lifelong changes that can support your overall health. This is us. This is InspireHealth. We're just around the corner. We're just on like Granville and Broadway. And thank you.